Well, welcome back, everyone. Well, preventable diseases are on the rise, so we've invited Lisa Horstman from Allen County Public Health in today to discuss that. Welcome, Lisa.
Thank you.
All right, so give us the laydown. What's going on?
Well, since the pandemic, we've seen actually a decrease in immunization rates for childhood routine vaccines. And some of that is probably partly due to children still trying to catch up from not being able to get in to providers. But also I've talked to some providers in the area, and they seem to think there could be some vaccine hesitancy on the parents' part. And so we at the health department want to encourage parents to talk to your provider. If you have questions, you can call us to answer questions, concerns, address those, sometimes fears people have over getting vaccinated.
Yeah, so. Well, like, measles, we never really talked about it for so long, and now we talk about it all the time. It's on the rise and on all these different states, and is it something that is just, people are just afraid to get their measles shot? Is there misinformation going on the web, or all of the above? What is that?
I think it's partly all of the above, but you're right. I just saw, I believe it was 17 states, and Ohio's one of those states with the measles cases. And measles is a very contagious, serious disease. It's a respiratory illness, leads to a rash. So when there's a measles case confirmed, people jump into action right away because it is serious. But the good thing is that the MMR vaccine, measles, mumps, rubella, protects children starting at age 1. You're recommended to get 2 doses at age 1 and then at kindergarten age. And it's highly effective against measles. So that's the good news with measles. We also have, there's been pertussis cases, also known as whooping cough. Long time ago, it was called the 100-day cough.
Okay.
And with pertussis, it's particularly harmful to infants. And so we want to protect those infants by having everyone around them immunized, even expectant parents, maybe grandparents. But in preparing to come today, I just recalled a conversation I had with a nurse here recently, and she said her grandchild had contracted pertussis, and she said that 100-day cough, she said that is for sure. Wow. She said it was really bad, and they're recovering, but it was a long road to recovery. And so there again, we have the shots beginning at 2, 4, 6 months, and then again at a year to protect against pertussis. Yeah, so
that's crazy.
Right.
There's stuff that we just never really talked about because you got your vaccine when we were younger. We got your vaccine, and that was it. It was not around.
Exactly.
Maybe in some third world countries and whatnot that we tried to get vaccines over there, but never here in the United States. And now we're seeing it everywhere.
Right, and we have seen an uptick on some of these vaccine preventable diseases. So that's why when we do see a decrease in the rates, it is concerning. That increases the likelihood of someone contracting one of these diseases.
And then you just said, if there are any concerns or if you have any questions, talk to your provider because, they can give you the information that you need and that people are looking for. And, the fears, the anxiety that may be around it or something, they can calm those nerves.
Right. And, we've, at the health department, it's very rare that you would have a very bad reaction to a vaccine. It is very rare. And so it is important, like you said, talk to your provider. You can call us and
Well, I always think about the commercials that have like anything from vitamins to an anti-inflammatory, and there's always like warnings of could experience this or this or this, and everyone just takes it because they need it or they want to feel better or they want their vitamins or whatever it is, and so they just take it. There's no questions asked. But vaccines, there's a little bit of a hesitancy for whatever reason.
And for the most part, they're usually mild, maybe some injection site pain, a little soreness, redness.
But easy peasy, lemon squeezy, and it's such an important thing to do, right?
Exactly.
All right. Well, Lisa Horstman, thank you so much for coming in today from Allen County Public Health.
Thank you.
Appreciate it.
Thank you.
All right. Well, don't go away because we have more when we return.